Hello, good morning. Well, first of all, I would like to introduce the members of our group. Sara, Montse, Fran, and Javi. And me. Well, my name is Cristina. Okay. Well, we are going to talk about general practitioner. That is a medical practitioner who treats acute and chronic illnesses and provides preventive care and health education to patients. Historically, the role of a GP was once performed by any doctor qualified in a medical school working in the community. However, since the 1920s, general practice has become a specialty in its own right.
Okay, I'm going to talk about point A. Then, what is a GP? As we said before, a GP is a medical practitioner who treats acute and chronic illnesses and provides preventive care and health education to patients. General practitioners intend to practice a holistic approach that takes into consideration the biological, psychological, and social factors relevant to the care of their patients. The duties are not confined to specific organs of the body, and they have particular skills in treating people with multiple health issues of any age and sex, and to levels of complexity that vary between different countries. Then, in what type of organizations can a professional work? Then, in health system of different countries, and also ONGs such as Doctors Without Borders, Save the Children, or the Red Cross. So, what is the salary range of a GP? Well, it is estimated a GP in the States may earn an annual wage of $172,000, but it will depend on the state the person works. And especially in Spain, taking a person, a model of a professional who has worked a total of 20 years, a doctor will earn about 56,000 euros per year.
Hello, I'm talking about the point B. Well, the first step needed for this profession is to pass the medicine's degree. This degree consists of 6 years, which the first and second year are theoretical at university blended with laboratory practice. The third year is theoretical mixed with hospital practice. In the fourth, fifth, and sixth year, theory and practice is given at hospital. After passing the degree, the newly doctor must pass the MIR exam. The mark which you get and that will determine your specialty is made by the average of your MIR exam and your academic record. To be a general practitioner, it's not necessary to get a high final mark. After passing the MIR exam and choosing the general practitioner specialty, the newly graduate become a médico interno residente that will train to be a professional GP. Each specialty has different training years. A general practitioner specialty has 4 years of training. After these 4 years of médico interno residente training, the newly graduate become a general practitioner.
Hi, I'm talking about point C. The most common diseases that a general practitioner is responsible to diagnose and treat are hypertension and flu. The most common causes of hypertension can be that there is an abnormal function of your kidneys, overweight, high level of stress, another previous disease in your family, or if the person smokes. For this disease, there are no specific symptoms. It is diagnosed by a general practitioner while doing a regular checkup with the sphygmomanometer. When a patient is diagnosed with the disease, the main target of the treatment is to reduce their arterial pressure so the risk of possible complications are lower. The treatment of this disease can be have a healthy diet with reducing the amount of salt, a lot of fiber and potassium, and drink a lot of water. Also, you can practice regular exercise during 30 minutes a day. The other important and most frequent disease that a GP is responsible to diagnose and treat is the flu, caused by the virus influenza. Unlike the previous disease, this has specific symptoms as can be headache, vomit, nausea, and fevers. Normally, a doctor can diagnose this disease only with the information given by the patient during the interview. The normal treatment is using pharmaceuticals as can be paracetamol, ibuprofen, that keeps the levels of fever lower.
In conclusion, a general practitioner treats both acute and chronic illnesses and provides preventive care and health education to patients. Unlike other medical specialties, they practice a holistic approach, taking into account not only the biological factors, but the psychological and social factors too. They can work both for NGOs and health systems, and their annual wage mainly depends on the country and region. To become a general practitioner, you first need to have a degree in medicine. Then you must apply for the MIR, and according to the grade you get, you choose the specialty you want. Thanks for watching, and bye-bye.